So, in fact, we tell all our smokers to get screened. It affects your body, it affects your muscle mass, it affects your nutrition level. It has a direct relation to heart also.
Ma'am, what are some of the common treatment options available for COPD patients?
Every disease has its phases, and COPD being a long term disease will have phases when the patient worsens. You should be able to exercise, swim, and do whatever you want to.
I think, ma'am, your answer answered a couple of my other questions that, can someone with COPD live a normal, active life?
For instance, a person who's a laborer and who's exposed to cement dust, or patients who are exposed to paint, varnishes. A lot of people in the construction business, because they are exposed to a lot of these particulate matter.
Hi, ma'am. Such a pleasure to be here. Please tell our viewers something about yourself.
Hi, Vani. It's a pleasure to have you here. So, my name is Dr. Anshum Aneja Arora. I'm a practicing pulmonologist in Gurgaon. And pulmonology, as you all must be knowing now, is a branch that deals with chest disorders and lung disorders. I'm a mother of two toddlers. I'm a travel enthusiast, and I'm the founder of Pulmonology Read Aloud, a portal for education for upcoming chest specialists and doctors. So, great to be with you.
Wonderful to have you here, ma'am. Hi, ma'am. First, I wanted to ask you, what is COPD? How does it affect the lungs? And how is it different from asthma?
So, Vani, COPD essentially is a short form of a term called Chronic Obstructive Pulmonary Disease. Now, as the name suggests, it's a long standing disease of the lung where there's an obstruction in the flow inside the lung. So, basically, this is a disease that starts as a result of exposures of the lung to noxious chemicals or fumes or toxic materials, including our pollutants. And this causes damage to the alveoli and the structures that are involved in exchange of air and oxygen and carbon dioxide in the lungs. It also affects the smaller passages of the lungs, which we call the small airways, and therefore the patient starts developing pulmonary symptoms that persist for a long time.
Thank you, ma'am. That is very informative and helpful. Ma'am, next I wanted to ask you, what are the main causes of COPD?
So, COPD essentially was always thought to be as a smoker's disease, and it was believed for a long time that only smokers who are above 45 years of age develop this disease, and you need to smoke for around 10 years, 10 cigarettes a day for around a few years, and you will develop COPD. But recently, we've come to know that a lot of non smokers also develop COPD. In fact, in developing countries like India, almost 60% COPDs could be non smokers. So, there the risk factor would not be smoking or tobacco per se, but it could be other exposures. So, here the risk factor could be the chula smoke exposure indoor, or a child who's playing in his house and his father is a chain smoker, so the passive smoke. It's also very common in Indian pundits because of the havan exposure in families with dhoop agarbatti being overused. And of course, the indoor and outdoor air pollutants nowadays are very common risk factors for developing COPD in future.
Ma'am, who is most at risk for developing COPD?
So, if we have to relate it that way, is a smoker will have the most chances of developing COPD. And if you've been smoking for around 10 years now, then the propensity of COPD will be very, very high. So, in fact, we tell all our smokers to get screened and evaluated for COPD because there's a very high chance that after you've smoked that duration, the changes have already begun. But even otherwise, as I mentioned, in Indians and in other nations where there is a lot of overcrowding, closed spaces, and pollution. The common risk factors here would be for a person who's exposed to these fumes, these toxic chemicals. We also see it a lot in certain occupations, like, for instance, a person who's a laborer and who's exposed to cement dust, or patients who are exposed to paint, varnishes. A lot of people in the construction business, because they are exposed to a lot of these particulate matter, and people in factories, for instance, who are exposed to benzonates and other chemicals, they can all develop COPD in the future.
Yes, I think, ma'am, so an important point to note is that it's not just smoking,
Yeah.
but a lot of causes are there. A lot of people are at risk for COPD,
Yes.
and it should be noted.
Yes.
Please tell us, what are some of the early warning signs of COPD that people should not ignore?
So, firstly, I think the first warning sign is for all smokers who consider their early morning cough and a little phlegm that comes out in the morning as normal. People often say that it's smoker's cough. It's so common. So, it's just that I have. That's one of the earliest signs of an entity called bronchitis, where there's inflammation in the passage in the pipes of your lung, which is one of the types of COPD. So, not all COPDs will have breathlessness to start with. They may just have a mild cough, a persistent cough, or a chronic production of mucus. That could be the first sign. But yes, once you develop breathlessness, where you could walk a particular distance without being breathless and now you're stopping for breath, is one of the signs. A lot of times it also comes as frequent infections. So patients would say that, I get sick more often. I have to take antibiotics and other medicines because of late my cough and all keeps coming back. That's also one of the earliest indicators. So watch out for your cough. Has it changed? Is it worsening? Are there many infections? Are you getting sick more often? Are you fatigued overall? Because COPD is actually a systemic disorder. It affects your body, it affects your muscle mass, it affects your nutrition level. It has a direct relation to heart also. So look out for other signs, and breathlessness definitely. That's a red alert actually, that there's something which is terribly wrong which is going on.
Yes, so I think the early warning signs should not be ignored at all.
Yes.
Ma'am, how do doctors confirm a diagnosis of COPD?
So, well, typically, if we get a good history compatible with the risk and exposure and onset of respiratory symptoms, that's how we start suspecting that a patient could have COPD. Although it can happen earlier also with smokers, usually a patient above 40 years of age or 35 years of age starts having more of a risk. However, the diagnosis is established using spirometry or pulmonary function testing, which is a very, very common non invasive test wherein you have to breathe in and out into an apparatus that measures your lung volumes, capacities, how tight your airways are. And that's the test that is, diagnostic for COPD in most cases. Sometimes we also do X rays, CT scans, and other tests to confirm our diagnosis. But for whoever is suspected to have COPD, a spirometry, a lung function testing, and of late another entity called oscillometry, that is very important to determine the diagnosis.
Okay, ma'am, that is very enlightening. Ma'am, I wanted to ask you, is there a cure for COPD or is it a lifelong condition?
Yeah, so unfortunately, there's no cure. So, when I say no cure, it means that once you have an exposure and resulting changes in the lungs, they are usually progressive in nature. And all treatment that we do is directed at slowing down this progression. However, if it's an early smoker, a patient who's more young and shows signs of pre COPD, as we call it nowadays, an early COPD, and we can stop the exposure, there will be a good chance for that patient to match the lung function decline as in a normal person. So, you and me, when we turn 40 and 45, we are all going to have a particular decline in our lung capacity every year. But if it's a COPD patient, that decline is multiples. And if we could stop the exposure, then you could reduce the rate of that decline. So it's not curable to the sense you can't reverse what has happened, but you can definitely stop the progression, slow the progression, and all treatment is directed towards it so that the patient has a normal life.
So, ma'am, as you mentioned that there is no cure, but we can have certain treatment options that can slow down
Yes.
the progression.
Yes.
Ma'am, what are some of the common treatment options available for COPD patients?
So, since COPD is a disorder of your airways, so the best form of treatment is the one that's directed to the airways. And what is directed to the airways is inhalers. I often tell my patient, you have an eye issue, you put an eye drop. You have a ear issue, you put an ear drop. You have a skin issue, you put an ointment. And so, if you have a lung issue, you need the medicine to go in your lungs. So, the best form of treatment would be the one that sends the medicine directly to the lung, which could be an inhaler, which could be a nebulized medication. So, that's how we treat it. And since COPD is an inflammatory disorder, I told you it affects many parts. It affects the heart also, our nutrition, our muscles also. So, we give anti inflammatory. So, anti inflammatory treatment is the cornerstone for COPD management. We give these drugs through inhalers. And as the severity increases, a lot of times patient also requires medicines called bronchodilator, which open the passage of the lung, the airways, and also inhaled steroid medications. So these can be often combined in combination and delivered through the inhaler. And there are some other medications also like mucolytics, because a lot of time patients have a lot of mucus production, and other medications that can be added to again give patient more symptomatic relief.
Thank you so much, ma'am. Ma'am, next I wanted to ask you, what is a COPD flare up or exacerbation and how to keep COPD from worsening?
Wonderful. So, every disease has its phases, and COPD being a long term disease will have phases when the patient worsens. This worsening of the patient, which happens over a short period, say over a week, 10 days, that is what constitutes an exacerbation. So, patients would usually notice that there's a change in their symptomatology. So, if they've had a cough that persists, it would increase, the mucus would increase. There may be infective exacerbations where, say, a bacterial infection caused the exacerbation or a viral infection caused the exacerbation. So there could be fever. There could also be a lot of fatigue or a new onset breathlessness. So such a event which happens over 7 to 10 days acutely is an exacerbation, and an exacerbation in a COPD is the point where whatever recovery you've made, that can suddenly go downhill. So patients have to avoid exacerbations, and more than one exacerbation in a year could affect how your disease is progressing. So as early as possible, it's important to pick up that exacerbation by noticing the change in their symptoms and reporting it to their doctor so that we can identify, increase the medication, and bring it back to normal.
Yes, ma'am. As you rightly said, I think it's very important to constantly be in touch with your doctor and make sure that it does not exacerbate. Ma'am, the next question I feel, it's a very common question that, is it safe for someone with COPD or even helpful for patients with COPD to exercise?
Oh, yes. I think the whole target, the whole aim of therapy and treatment is that you should lead a normal life. And when we say a normal life, you should be able to exercise, swim, and do whatever you want to, and your breathing should not disrupt that. So, in fact, exercise is therapeutic for COPDs. We do a form of a therapy called pulmonary rehabilitation, which involves a lot of physiotherapy, exercising, endurance training, strength training for COPD so that they can stay fit. So, yes, they must exercise. However, if their symptoms are stopping them from exercising, it's again a clue that you need some modification in your treatment. So, again, your doctor has to know about it so that we can change the treatment. But yes, exercising, rehabilitation, strength in the upper part of the body, the lower part of the body, that's very important when we manage a COPD.
Thank you, ma'am. And thank you for informing us about a pulmonary rehabilitation program, like you said, that can really help. Ma'am, so in healthcare, all the time there are these breakthroughs and innovations. So in COPD, also, have there been any recent breakthroughs or innovations that you can tell us about?
Yeah, so COPD treatment has undergone quite a revolution, and we are at a standpoint where we are looking at identifying particular types of COPD and treating them based on personalized medicine. So this is called as phenotyping in medical language, where every disease will have different ways of presenting in different individuals. So we are at a point where we are able to phenotype COPD and offer personalized treatment. We are also at a recent breakthrough where we have medicines called biologicals, which were not earlier available for COPD and were available for asthma, were available for a lot of other diseases like rheumatic diseases. which are now going to be available for COPD in the future, where one injection, say in a month, could keep the patient symptom free for a longer time. Also, as I said, inhalers are the mainstay. So we've had a lot of changes in the way inhaled therapy works. We've had single inhalers that can give as many as three drugs together. And gone is the time when patients used to have multiple inhalers and multiple medicines. So we've come to a point where we are able to deliver more efficiently in much more restricted form. So patient doesn't have to do polypharmacy and he can get a lot of medicines targeted using the same device.
Thank you, ma'am. That is so insightful. Ma'am, how does COPD rank in seriousness compared to other diseases?
So I want you to understand that COPD is the fourth leading cause of death worldwide. So we're looking at cancers, we're looking at cardiac diseases. And if you look at all of that, if you look at non-communicable diseases, COPD is ranked fourth. In fact, it may be third very soon. And in India also, COPD is one of the leading cause of deaths in non-communicable diseases. So COPD is something that is very, very prevalent. In fact, in 2023, when a survey was done in India, it was found that the prevalence or the existence of COPD in our population was as high as 7.4%. That means if 100 of us are standing in a hall, 7 to 8 of us will be having COPD. And that's a huge number.
That's a huge
Considering that not everybody is a smoker. So, again, if we talk about smokers, then a large population of smokers will be having COPD and they would not know about it and they would continue to smoke, wherein smoking cessation is the answer. So, COPD is very rampant, very neglected because, these symptoms are taken very lightly. Okay, I smoke and that's why I cough. And that's not all about it because it will progress and it will progress to a point where, at a point the patient cannot climb a few steps or he cannot play with his grandchildren. He cannot lift heavy weights or this patient goes to the hospital frequently because he's sick more often. And it's very disheartening to see patients with severe COPD tell us, I can't comb my hair, or I get too breathless when I wear my shirt, doctor. I can't button my shirt. Why? Because they've become so seriously affected that their day to day activities are affected. So that's what we want to avoid. And that's why all this awareness is needed because you can stop it. And we may not have severe COPDs if we manage them when they are quite mild or moderate in intensity.
Oh, I didn't know it ranks fourth. That means it should not be neglected. It should be taken very seriously. And they should, people who feel that they could have COPD should not take it lightly. I think, ma'am, your answer answered a couple of my other questions that, can someone with COPD live a normal, active life? And, even why spreading awareness, even through this health talk, why spreading awareness about COPD is so important. So, thank you so much for helping us spread awareness about this topic. So, ma'am, what's your advice for someone who's just been diagnosed with COPD?
So I'll give you an example to start answering your question. One of my patients was a cricket player, and he's now 75 years of age. And he used to play cricket for his team, for the state, and whatever.
Wow.
But ever since he started developing these symptoms, the first thing he noticed was, I can't play my game.
Oh,
So the children attributed it to age and said maybe because you're getting older, it's difficult for you. And once he was diagnosed and put on treatment, he's now played his match recently with his senior group.
how wonderful.
And he was elated because it was a part of his lifestyle that was missing.
Of course.
So for all patients who have COPD, for all people who've now understood that they could be at risk, first is identify, meet a doctor, go to a pulmonologist and do a spirometry. It takes only 15 minutes to do a spirometry. There is no invasive testing. You don't need a blood sample. It's just breathing in and out into a machine. And there you have it. The diagnosis is there. Get it treated, and you will see how you can manage your life better. So, the earlier you act, we will be in a position to help you better. So go for it. And spirometry, if you're a smoker, do it every year, I would say. Do it in your health checks, get it checked and confirmed, and go about it.
Ma'am, thank you so much, for helping us spread awareness. This has been so insightful, so helpful, and you are so inspiring, not just as a doctor, but you're a mother, you travel also. So thank you so much for being with us today for this health talk. Thank you so much.
Thank you very much, Vani. Thank you.